Hello, my name is Tyler McKenzie, current OMS2 at Oklahoma State University College of Osteopathic Medicine at the Cherokee Nation. And today I'm going to be presenting the research that myself and my colleagues completed. The title of our project is Geographic Atrophy, a meta-analysis of equitable reporting and systematic reviews. The corresponding authors are including myself, Ryan Emmert, OMS3, Dawson Smith, OMS2, Hannah Russell, OMS1, and Dr. Micah Hartwell. A bit of background on geographic atrophy is that it is secondarily caused by age-related macular degeneration, or ARMD. ARMD is currently the leading cause of legal blindness in individuals over 65 in developed countries, such as the United States, for example. In 2019, an estimated of 19.8 million Americans are living with ARMD. Again, geographic atrophy is a sequelae of dry ARMD. Dry ARMD is described as not having the presence of neovascularization that commonly is associated with wet ARMD. Geographic atrophy is further characterized by central blinding because it affects the macula of the retina, and also demarcated lesions can be visualized. They are composed of pseudodrusen or lipoprotein, and they appear in the perifoveal macula and the peripheral retina. Our objective with our research project was to assess systematic reviews and meta-analyses, or SRMAs, for components of the Progress Plus model relating to geographic atrophy, and also to establish whether equitable reporting is currently taking place in geographic atrophy literature. To begin our methods, we had two researchers initiate a systematic search within different databases such as PubMed, MBOS, and Cochrane, and they were looking for whether or not GA was mentioned in the literature to be included in the data extraction. This was done in a masked and duplicative fashion. Two additional researchers extracted the data following the Progress Plus model. The Progress Plus model includes different factors such as place, race, ethnicity, occupation, gender and sex, religion, education, social capital, and socioeconomic status, and additional factors of the SRMAs. A Google Docs form was created, and in the form we had different criteria for whether or not the Progress Plus items were mentioned in the literature, and this was reported onto the form. For any conflicts with the data extraction, SRMAs were then evaluated by the first two researchers and reconciled via discussion. With our initial search, about 176 articles were returned, of which 119 were excluded due to duplication or they did not mention geographic atrophy. Of the 57 studies that were included, 26, which was about 45.6%, did not include any Progress Plus items. Of the SRMAs, 3 studies included more than 5 Progress Plus items, including one that incorporated at least 10. The most common items included within the SRMAs were age, sex, race, and ethnicity, while only 31.3% of the SRMAs conducted in the U.S. included equity items. About 63.4% of those conducted outside the U.S. did, with a p-value of 0.028. And here's a table that visualizes some additional items that we reported within our Google Forms, such as location of study, affiliation of first author, the funding for the study, mentions Prisma Equity or Progress Framework within the article, and did the systematic review include any patient-reported outcomes as assessment measures. In conclusion, our study found that some Progress Plus items were consistently reported within SRMAs. However, other common items such as education and socioeconomic status were severely lacking. As new initiatives by the American Academy of Ophthalmology are underway, aiming to improve equity reporting within SRMAs, it is necessary to increase our understanding of epidemiological factors, as well as provide more comprehensive treatment guidelines for all individuals. Authors should try to incorporate relevant equity items within all SRMAs to provide clinicians with evidence related to all potential patients to ensure appropriate diagnosis, better prognosis, and optimal treatment plans. And here are the references. Thank you all so much for your time. If you have any questions, feel free to reach me at tyler.mckenzie@okstate.edu, and I'm looking forward to seeing everyone on Research Day.